Today, we're going to talk about the different types of costs related to health insurance plans. If you become overwhelmed or confused when trying to understand your healthcare costs, you're not alone. Many people have a hard time with this. This includes Emilio, who's choosing between two health plan options. His son, Alejandro, is helping him. All plans are different, so knowing how the costs of the two plans compare can help Emilio decide which one works best for him. The first type of cost Emilio has to consider is the premium, which is the amount you pay each month to buy the plan, even if you don't go to the doctor or use any prescription medicines. It might help to think of it as a membership fee. Emilio's first option, Plan A, has a $50 per month premium, and his second option, Plan B, has a $100 per month premium. Emilio was ready to go with Plan A because it was less expensive every month, but Alejandro reminded him that there are other costs to think about. The next type of cost Emilio checks is the deductible, which is an amount you have to pay out of pocket before your plan begins to pay. This could be a few $100s to several $1,000s per year. It's important to note that the money you pay for your premiums does not count towards your deductible. Emilio sees that Plan A has a deductible of $1,000, while Plan B has a deductible of $500. That means for Plan A, he'll need to pay $1,000 before his plan begins to pay. For Plan B, he'll need to pay $500 before his plan begins to pay. Alejandro tells Emilio that plans with lower premiums usually have higher deductibles. The third type of cost Emilio has to think about is copays or coinsurance. These are the amounts you pay each time you go to the doctor, go to the hospital, get a treatment, or get a medicine. Emilio isn't sure what the difference is between these two costs. Alejandro explains that copays are usually a set amount. Coinsurance is usually a percentage of the total cost. Let's say Emilio has a treatment that costs $100 total. If he has a copay for this bill, it would be a set amount, such as $10. If the bill said he had coinsurance of 20%, he would pay $20. Going back to Emilio's choices, Plan A has a coinsurance of 20% and copays of $50. Plan B has a coinsurance of 15% and copays of $25. It's important to note that whether there is a copay or coinsurance depends on the medical service or medicine. If a visit involves multiple treatments or doctors, you might have to pay both. The last thing Emilio has to think about is the out-of-pocket maximum, which is the highest total amount you'll pay every year. This includes the amounts you pay for your deductible, copays, and coinsurance. Once you've reached the out-of-pocket max for the year, your plan will pay for any additional costs. This amount resets at the start of each plan year. Emilio's Plan A has an out-of-pocket maximum of $5,000 per year, while Plan B has an out-of-pocket maximum of $2,500 per year. Now that Emilio knows all of the basic costs of each plan, he has to think about how often he'll use it. Alejandro points out that the first plan seems to be better for someone who doesn't go to the doctor often during the year. Even though the out-of-pocket costs are higher, someone who doesn't have a lot of healthcare needs won't pay them very often, and they'd be saving money on the monthly payments. However, Alejandro reminds Emilio that he has a lot of doctor appointments during the year, and he takes some very expensive medicines. He recommends Plan B because even though Emilio's monthly payment will be higher, he'll save on his total out-of-pocket costs. To find out more about how much your health insurance options might cost, call the health insurance plans. If you get your health insurance through your job, you can talk to someone from your Human Resources department. If you need help paying for your medicine, there may be programs to help you. Ask your doctor about available financial assistance options.